Good morning. My name is Mark Pelka from the Office of Policy and Management, Undersecretary of Criminal Justice Policy and Planning. And today's a great day, a historic day, because of the Governor's announcement of his nomination of Angel Quiros to be Commissioner of Connecticut Department of Correction. I want to begin by applauding the Governor for launching a national search for a Corrections Commissioner who can represent the top talent for the crucial position of leading the DOC. The Correction Commissioner is responsible for housing almost 1,000 people, employing almost 6,000 people, operating 14 correctional facilities across our state, and administering 5 parole districts. In other words, it's a demanding job that requires real leadership at the helm of the department that faces massive and sweeping responsibilities. The national search stretched across the country, but ultimately led back to home, to Connecticut, to Angel Quiros. Quiros, who currently serves as interim commissioner, has a sort of credentials that would make him a coveted selection for any state across the country. But we are fortunate that he grew up here in Hartford, about 1 mile here from the Capitol on Park Street, and dedicated his service to the people of our state. There are 3 qualities that Commissioner Quiros possesses that I would like to emphasize. He has 31 years of correction experience, beginning with a correction officer at the Hartford Correctional Center in 1989. And from there, he worked his way up the ranks: lieutenant, captain, unit manager, major, deputy warden, warden, district administrator, deputy commissioner, and interim commissioner. He did the hard work to earn this progression through the department. Correction professionals who do the hard work inside our facilities every day, including working through the pandemic, should feel assured that there is someone leading the department that has their best interests and needs at heart. You need the 31 years of experience to really generate that knowledge of corrections in your bones, which is what he has. This experience has given him a command of correction operations that's unmatched. And by correction operations, I mean intake and management and transition of inmates, patrol operations, inmate services and counseling, emergency preparedness, and plenty more. And when he's tested on the job, Quiros makes the tough but the right decisions, consistently acting to protect the safety and security inside of our correctional facilities and the people who are housed there or who work there, as well as the public on the outside. Third, Quiros is a man of unqualified integrity. I've always been struck by how Quiros knows the daily count of people under DOC custody on any given day. More importantly, he knows that each of those numbers represents a human being with a family, friends, and other loved ones back home who are worried, concerned, and wondering about their well-being. And they count on the department to do its best job every day to protect the safety and security of the individuals under its custody. Connecticut is deservedly recognized across the country for the progressive, data-driven correction reforms it's achieved. The implementation of data-driven criminal justice policy and practice, after all, is something that brings together Republicans and Democrats from across the spectrum. And in July, Connecticut reached a milestone that few, if any, states had reached. Since February 2008, our correction population has fallen by half. And during that time, our reported crime and arrests have dropped, leading to a safer state for our residents. And the number of people who return to prison because of recidivism has decreased, showing the positive impact of giving people a shot at earning their second chance can have. And just recently, the DOC announced a dramatic drop in the number of people returning to prison for a technical violation. That's no new criminal conviction, but rather a violation of the conditions of their supervision. So Connecticut has demonstrated to people in our state and people around the country on the path to cutting crime, safely reducing the number of people incarcerated, and reducing recidivism. And during that entire period, Interim Commissioner Quiros was serving in critical positions inside the department, helping to implement key elements of progressive correction policy and practice, all the while readying himself for the summit that he has reached today, with Governor Lamont nominating him to be the next Correction Commissioner of the state of Connecticut. Interim Commissioner Quiros is experienced, prepared, and committed to sustaining and building on Connecticut's criminal justice achievements, helping to lead the way to the next evolution of progressive correctional practice. But at the same time, Governor Lamont recognizes that corrections in the United States faces extraordinary challenges presented by COVID-19. Quiros knows that during this public health emergency, correction operations and health services need to be joined at the hip not only to protect safety and security, but also the health of people living and working inside correctional facilities. You see, correction administrators have to mitigate the risk of COVID-19 spread inside facilities, but also prepare people who complete their terms of incarceration and return to the community so they can be successful in an environment that is admittedly quite different since the onset of the pandemic. Folks completing terms of incarceration will encounter even greater and perhaps different challenges with employment and housing, mental health treatment, and remaining sober. And for those reasons, Connecticut needs a commissioner like Quiros who is ready to tackle these challenges and lead corrections during this unpredictable period. He's committed to leading a department that prepares people for reentry from day one of intake, partner effectively with the community, and help people return safely. We need a commissioner who has the experience, operations knowledge, and integrity to step into this position on day one, and Connecticut is fortunate to have found that man in Angel Quiros. This day, as I mentioned, is also a historic one that I think means a lot to the governor and to all of us who rely on corrections for safety and security, and that history will be made when Interim Commissioner Quiros is confirmed. He will be the first Latino correction commissioner in our state's history. And as many know, Latino people are disproportionately represented inside our correctional facilities compared to our resident population. And so I am filled with hope when I imagine the impact that having a man not only of Angel Quiros' stature, but also his heritage will have in inspiring people that he works with and people he visits inside the facilities. And I'd like to turn now to Governor Lamont, who throughout this process has not only been given a chance to get to know the interim commissioner even better as a professional, but the governor's got to know him as a man. And thank you, Governor, for the chance to deliver some brief remarks at the stop, and I'd like to turn to you, sir.
Thank you. Yeah, those are the same brief remarks you sent me to, and you nailed them really well. Look, Angel, we're here with Josh Jabal, by the way, who led this search. And I think you maybe know I'm the guy that always likes to shake things up around here, try and bring in the best and the brightest from outside, see what we can learn from other states, see how we can get better. We brought in Roland Cook a couple years ago from Utah, and he had to return back due to some family reasons. But he did say one thing. He said, you're in good hands with Angel Quiros. And he said, this is a state that you should feel very confident about what we're doing with corrections. So like I was with Vanessa Durantes and a couple of other folks that we've gotten key commissioner jobs, we look all over the country and find the very best person is right here, who's been serving this state and active in corrections, starting as a corrections officer 31 years ago. And man, you have seen a lot. I mean, we've gone through lock them up and throw away the key back 25 years ago, and that didn't work. We've been working hard on, criminal justice reform, and as Mark pointed out, here we are 10 years in, our inmate population 50% less than it was before, and crime still at an historic low. I think Mark told me it's at a 51-year low, from bad crimes to not so bad crimes. And I know what you're watching on cable TV, and I know Kenosha, and I know Portland, and I take nothing for granted. These things can flare up. But I think Connecticut has gotten it right, and it's gotten it right in part thanks to you and the good work you've done in corrections, making sure that corrections is corrections. And it's all about giving people a second opportunity. It's about keeping us safe and giving people a second chance when they deserve it. And you've been at the forefront of that. I know Roland was beleaguered at the end, and the ACLU and COVID and union. You guys did an extraordinary job throughout this COVID crisis. It's just worth mentioning, and Josh reminded me that very early on we set up a separate correctional facility for anybody infected with COVID. Smart thing to do. We've had a much lower rate of infections in our prison system than just about anywhere else in the state. Josh has led systematic testing in the correctional facilities. It started out at maybe 8%, I think is now down to 1%, so it's reflective of our broader community. And that's in part the respect we show for folks trying to get back on their feet. And he told me something really interesting that struck with me when we talked again the other day. He said, you can go to safe way, and maybe not everybody is wearing the mask, but they should be, but our correctional facilities, all the folks, corrections officer and inmates, are all wearing the mask. A sign of respect for themselves, a sign of respect for others, folks you don't necessarily think are all about following the rules or following those rules. And I think that says a lot about the dignity and respect you're showing people who are in our correctional facilities, and I think it's working. And you look at the broader community and you see a state that's relatively at peace, showing respect, leading with our police officers on the front lines to make sure that our streets are safe, and they're safe because of good work you've been doing in corrections for a long time. I'm really pleased to say you're our next commissioner.
Thank you, Governor.
You got it.
Good morning. Thank you, Governor Lamont. I'm truly grateful and blessed for the trust and confidence you have placed within me. And thank you to Undersecretary Mark Pelka for the kind words. Early on to my appointment as Deputy Commissioner, you stood out as someone who will likely become a valuable partner for DOC. And here we are. You've proven that and much more. Governor, I want to assure you that I plan not only to meet but to exceed your expectations that you have for the Commissioner of the largest state agency, the Department of Correction. My commitment is not only to you, my commitment is to the people of the great state of Connecticut that I serve. I don't take this responsibility lightly. I have to admit, I felt a little bit sentimental last week or so. In fact, when I was summoned to your office at the governor's office this week, part of the second round interview process, I would normally take the quick commute from Weathersfield and take the highway and head to the Capitol, to your office. I find myself taking an alternate route, one that might call this a trip back to memory lane. I drove down through the city of Hartford, past the old high school, Buckley High School on Weathersfield Avenue, that I walked every day from Park Street. Then I took a left onto Park Street through the old neighborhood that I grew up. In addition to the childhood memories that came flooding back, it reinforced the obligation and the responsibility you have given me. A large portion of the incarcerated population originate from big cities, Hartford, New Haven, Bridgeport, and now I have been given the amazing opportunity to have a positive impact on these communities and the offenders returning back into our society. My ride through the city had me thinking about individuals that contribute to my success along the way. I am blessed to have countless mentors over the years that have helped to shape who I am today. In addition, I cannot overstate the amazing team of men and women that make up the Connecticut Department of Correction. Their passion to keep communities safe, to help others, contribute to my inspiration. Recently, during the COVID-19 pandemic, when the word hero was mentioned in the media outlets, many referred to first responders, nurses, grocery stores, essential workers, and they are true heroes. I'm here to tell you that our correctional staff members are definitely heroes, as they walk the toughest beat of any law enforcement agency. And most importantly, I am forever grateful to my family, my wife, my son, who stood by me through it all. This career is very challenging. Often late nights, holidays spent away from the family on the job. They have lived through a true definition of sacrifice, and I love them for that. In closing, I will leave you with this. Connecticut has been long known as a national leader in criminal justice reform. I vow to continue us on that path by operating safe facilities while offering meaningful programming aimed at giving individuals a tool they need to be successful. No one deserves to be defined by their biggest mistake or their worst decision. Incarceration is the penalty. Our job is to prepare people for a fresh start. Today, I am honored to be the Governor Lamont's nominee. Blessed and grateful. Thank you, sir.
Giving people a fresh start, and it's working. All right, Rob, are there any questions?
Sure, we'll start things off with Hearst, Connecticut Media. Reminder to unmute your phones until you're called on.
Thanks, Rob. Hi, Commissioner.
Hi.
Could I get a couple basic pieces of information like your age and what kind of heritage you have?
I didn't hear the question.
How old are you in heritage?
So I was born in 1968, so I'm 52 years old, and I'm Puerto Rican, Hispanic, born here in Hartford, Connecticut, raised in Miami, Florida, and then at the age of 13, returned back to Hartford and grew up on Park Street on my teenage years in Hartford.
Thanks. And looking at the COVID protocol now, do you see the need for any changes?
I would tell you that back in March of 2020, when COVID first started, that the basic framework for handling a pandemic was there, but the unknown with COVID, with the disease, now, as I prepare the agency for the second surge in the fall, the agency is better prepared as far as the PPE inventory, the separation of asymptomatic offenders, symptomatic offenders, the separation of the offenders that are refusing to take the test. So there's a lot that's changed. The fact that early on during the pandemic, showers were not allowed, and now we're showering individuals that are symptomatic or asymptomatic. So we've learned a lot. There's a lot of data that we have in the department of mistakes that were made that led us to be better prepared for the fall. And I would tell you this, I will add this, that we're finishing the second round of mass testing for the offender population, and we're at a 3% compared to the first time around was 9%. And when you look at the symptomatic offenders in the month of July and August, there's been 4 each month, so which is an incredible improvement with our health service unit staff that are managing this day to day. To have just 4 in 1 month that are showing symptoms, we're definitely doing it right.
Thanks. And Governor, along those lines, the Connecticut State Police Union released a vote of no confidence in you yesterday. Are you concerned that these sworn law enforcement personnel might be involved in an imminent or ongoing job action in relation to their protesting of the House Bill 6004?
I don't think so, Ken. These are amazing folks who have been keeping us safe and doing it successfully for a long time. You're right, the union, had some issues and did this poll, but I don't think it has any meaning in terms of the commitment of our folks to keep this state safe. They're doing great work.
Thanks, Governor.
All right, thanks, Ken. Up next, Connecticut News Junkie.
Thank you, Rob. Commissioner Quiros, I just want to know, do you have any plans for handling the inmate medical system?
So the Inmate Medical Health Service Unit will continue to be a priority for the agency. When you reflect back 2.5 years ago when we made a transition from UConn to the Department of Correction, there was some bumps on the road, but I will tell you that the way the medical service staff handled the pandemic, the reason in particular in the month of April and May when we're spiked at probably 180 to 190 offenders symptomatic at Northern, it was the health service unit, the staff that came in, day out, and did a tremendous job to help stop the spread and attend to these offenders that were symptomatic. So the unit has greatly improved. There's still room for some improvements, but they've come a long way, and they're the real heroes too when it comes to fighting the pandemic inside the correctional facility with the treatment they were able to provide to the offender population.
Thank you. And my next question is for the governor. Governor, do you think that the lawmakers should have an opportunity to overrule your extension of the public health and civil preparedness emergency? Or is there another way for legislators to be more involved in some of this decision making?
I think there's another way. We had a really good meeting with the leadership, whatever it was, a couple days ago now, and I heard from leaders. Obviously, things were going really fast back in April and May. We did the best we could to keep them informed on our thinking regarding each and every one of those executive orders. Now we're at a more deliberate pace. Let's hope that keeps going and You know, Paul Mounds and our team, Bob Clark, have been very clear that we're going to keep the legislature well informed every step of the way in terms of EOs as they roll off and anything else we have to add on.
Should they be involved formally in any way to give more of a balance of power?
Right now, I think we're led by science. You've heard me say that about 1 million times. I welcome everybody's input, but rather than make it into more of a political process, I think what I'd love to do is lead with the science and then keep the legislature involved closely all along the way.
Thank you.
Thank you, Christine. Up next is Waterbury, Republican American.
Thank you. Could we get the salary for the new commissioner, please?
Anybody know that?
$167,500.
167,500. You know, I was just looking at the monthly indicators report, or actually the countdown today. We're looking at about 9,500 inmate population. Where do you see that going?
So I've been very clear, very transparent with our staff, the governor's office, my boss, that the count has gone down. And in the future, I do see facility closures, but we need to be very careful. As I prepare, the main focus right now is preparing the agency for the COVID in the fall. Allow us to get through the fall, early spring, and then there's going to be some serious conversation early on, 2021, probably March or April, about the possibility of facility closures. I've been very clear and transparent with the unions, with our staff when I go into the facilities. When you take a look at a March 1st, 2020, the agency had the bed space to close a facility of 500 beds. The pandemic put a stop to that. During the pandemic, we've lost 2,900 offenders that are back out in the community. So I just want to take the time to go through the second surge, if it comes, and have that space so that we can have the social distancing to stop the spread. But there will be some serious conversation come 2021.
Angel's taken the lead on this for some time, and you know, one of his many skills, where over the last number of years we've closed a variety of facilities, fewer beds, and done that in collaboration with the corrections officers and with a front and center eye on public safety, even though you have saved the taxpayers tens of millions of dollars along the way.
And I guess this is a question for both you, Governor, and the incoming commissioner. What about early releases if there is a resurgence of COVID-19 in the prisons? That's obviously been an issue in the first phase of this outbreak. So
I will give you some numbers on early releases. Under my statute, we utilize the reentry, 45-day reentry to 90-day reentry. To this day, there's close to 260 offenders that have been released under that statute. Then I'm going to take you to the offenders that were released from a facility to a transitional supervision. That means they had a stable home, had a sponsor. That number is over 1,400. Then we release another 1,000 offenders from facilities into the halfway house. And then we just didn't stop there. We went into the halfway house and find out individuals that were stable, that had a sponsor, that had a residence to go to, that had a job that they were working. And then we moved close to 900 offenders out of the halfway house into the community. And that has created the best space needed in our correctional facility, in particularly the dorm setting environments, where a dorm setting environment tends to be 120 to 100 offenders. I mean, we have dorms, the majority of our dorms are at a 50% capacity, which helps us deal with COVID.
This is Mark Palka, just adding a bit to that as someone who's tracked some of the data coming out of the Department of Correction, is that the Department of Correction communicated ways that it would be using its statutory discretionary authority to review eligible and appropriate people for discretionary release. And one way that was accomplished was the smart move during the reduction in the number of people coming in the initial months of COVID from the courts due to the court mitigation plan and due to changes in sheltering in place and at home. And DOC shifted valuable human resources to the back end of the system to work on reentry planning to ensure that anyone released under any of those statutory mechanisms has a home plan, has a sponsor, has a halfway house, but has a safe landing. And it was that merging of public safety and public health considerations that guided you through that period.
Governor?
I think you guys answered it pretty well, didn't you?
Okay. All right. And let me follow up then on 15's question, because I want to be clear. You're not proposing to give the legislature any kind of authority to reject or approve your executive orders issued under emergency declarations, correct? You're going to consult them,
I think the
but you're not going to give them...
I think the process has worked pretty well. I mean, we can, if you think I'm opening schools too fast, if you think I'm opening bars too slowly, if you have particular items that you feel really strongly about, you know, come and see me, and you know, we can talk, get your point of view. But having everything up for a vote of 151 people, I think, would be not the way to go.
Okay, it's 187, I get you though. Do you think this is, there's an element of politics in here? Because I mean, I just looked in my inbox and the Republican candidate for the 5th Congressional District is now criticizing your order. We're going to have a Republican news conference, House Republicans, in about a half hour. And, you know, we're getting into the sort of traditional kickoff of the election season. So do you think there is an element of electoral politics being injected here?
Yeah. Well, I'm shocked to hear there's politics in September for an election. But look, we had a really good meeting with the leadership. They expressed, you know, their thoughts on what we do going forward. I thought it was positive. They got some feedback from their caucuses. I appreciate that. But I think it's really important. Look, I think broadly speaking, we've managed this relatively well compared to a lot of our peers. And I welcome the legislature to have a particular point of view. You know, step in. I've heard from some of the Democrats, they think, hey, slow down. Why are you opening the schools? Let's stop. I've heard from some of the Republicans, open the restaurants now or faster. And we can weigh that. I've really been listening to the scientists every step of the way, what I can do safely, how, and I think it's worked pretty well.
All right.
Okay, thank you very much.
Thank you, Paul. Up next is Connecticut Mirror.
Good morning. Commissioner Quiros, what's the latest on allowing visitations to resume at correctional facilities?
So that's a huge concern for me, because as a commissioner, I know the importance of having that those ties, those social visits with the loved ones. We're getting to a point now where we're exploring the technology. MYI, we went into the youthful institution and we're doing Zoom visits. We're in the process now of doing a virtual visit via Teams and trying to set that up. I've given my team the deadline at the end of the month to give me a proposal of how that virtual visit is going to look. I'm also have a plan on going on now, how we're going to start up the non-contact visits, which is in the booth, which is more safe. And then the last piece that we'll tackle is the social visits. How is that social visit going to look when the citizen, the loved ones are coming into a correctional facility? I mean, there will be temperature checks, there will be wearing of the mask, there will be social distancing, and just trying to get that process. But we have to be careful too, because even though that a symptomatic offender has gone down and it's at a low peak, we still have 3% of the population that are asymptomatic, so I have to be very careful and very cautious, not only to protect the staff, protect the offenders, but then protect the citizens of the state of Connecticut coming into these correctional facilities.
Got it. And have officials given any thought to Securus, try to get more free phone calls for each person?
We got about 1 out of every 3 words there, I think.
Yeah, you're breaking up on that last question.
Have officials given any thought to talking to Securus about trying to get them to phone each week? make?
Early on during the pandemic, there was conversation with Quiros on the allowing the 2 free phone calls a week. I do have the stats of the monthly calls that have been made to family, the minutes that they've spoken, and it's been a great help with that.
Thank you.
All right, thank you, Kellen. Up next is Channel 3 Eyewitness News. All right, moving on to Fox 61.
Hi, Governor, and hi, Angel. It's Matt Karen at Fox 61. Thanks for the news conference. I have one question for Angel and one question for the Governor. Angel, obviously we're going through, a global pandemic, but we're also going through an epidemic related to opioid abuse. And I'm interested in getting your philosophy on that. If you think this is a criminal issue or more of a mental health and addiction issue, and how you would handle that.
So many may not know, we currently have facilities online with the medical assistant program, MAT, that we call. In our line item budget for F21, we have like $6 million to address the substance abuse. We're currently in conversation and finalizing, expanding into 4 other correctional facilities. So by next month, we'll be in 8 correctional facilities that we're providing methadone treatment to offenders that come in with a substance abuse and getting them ready before they go back into the communities and putting them on methadone. So 10 out of the 14 facilities will have that program, and we're looking down the road on how we bring those other 4 facilities online with the addressing the substance abuse.
This is Mark Pelka jumping in real quick just to add that I had the pleasure of joining a meeting the Interim Commissioner Quiros invited me to yesterday with his addiction staff, and we discussed the work being done inside the Department of Correction to implement the funding that Governor Lamont included in his first biennial budget to expand medication for opioid use disorder treatment among people within the Department of Correction. For many years, DOC had a program and utilized some federal dollars and used funds they could pull together, but the investment that Governor Lamont made is going to save lives. Every year, the division I run releases a report showing the percent of people who experience an accidental drug overdose death in Connecticut who had at one point been inside a DOC facility. And the number has risen beyond half, where over half of the individuals who die of an accidental drug overdose death have been in DOC. So hearing this program come to fruition, Commissioner, is going to make an enormous difference, both in terms of expanding the number of facilities where it's provided, but also expanding the types of FDA-approved medication, the ways that people can access the services, and the people who are ready to help deliver this life-saving support. So it's something really, I think, will be much more to come during your term.
Yeah, man, I just,
And
for the
Go ahead,
buyers,
Governor.
that's an addiction issue, that's a health issue. I don't want stigma discouraging you from getting the necessary Narcan and other things you need to get back to good health, and I think that is priority number 1. For those guys who are pushing this stuff, laced with fentanyl, that's a criminal offense, so we're gonna come down like a ton of bricks on you.
Governor, on the no confidence vote from the state police, I just wanted to ask you, the Office of Legislative Research did hint at the fact that there may be parts of that bill that did conflict with the union contract. So if that's the case, are you committed to reevaluating and maybe amending parts of that bill?
Yeah, why not? If there's something that conflicts with the law, we have to clean that up. We'll do that probably not in this short session, but we'd certainly do that next year. I'm told nothing goes into place for another 11 months anyway, so the legislature smartly anticipated there may need to be some cleanups to the bill.
Thank you, guys.
Thank you, Matt. Up next is News 12 Connecticut.
Hi, Commissioner. Earlier on, you acknowledged mistakes that were made at the beginning of the COVID crisis. Can you kind of elaborate on that? What mistakes do you think happened?
Well, you have to understand too, COVID-19, when I indicated that we have the framework how to handle a pandemic, We were unsure about COVID early on. The advice was given not to shower the offender population because of the ventilation and so forth. We acknowledged that early on, maybe that was not the best decision, and then corrected the decision to allow the showers to happen after we had more information and more data. So the mistakes that were made were not intentional. This was just a mistake, not having the data, not having the, not knowing what COVID-19, the disease and was bringing.
And Governor, a quick question for you. Right now, the legislature is holding a hearing on what to do with nursing homes. The industry is telling them that there's a real fear of mass closures of nursing homes because they're drowning in expenses. They have a smaller patient population. They're saying we need financial assistance. Do you think that that's necessary? Why or why not?
Well, let's face it, occupancy is down by, better than 25% due to some lousy reasons. And there is a thought about what will nursing homes look like in the future. Will they perhaps be more for acute care patients? And if you don't necessarily have to be in a nursing home, if we can find accommodations, allow you to stay at home with a home health aide, maybe that will be part of the solution. But right now, I don't see any changes. Let's get through what could be, as Angel said, a potential surge in November, given the flu season and the such. We found out a few months ago it was pretty handy having a little extra capacity in our nursing homes so we could get those who were infected into separate quarters, just like we were able to do with our correctional facilities.
So, Governor, I want to clarify that, though. When you say no changes, do you mean no additional funding from the state or what?
Well, you were talking about do we have the right number of nursing homes, and I was thinking, look, I don't see any imminent changes, but we'll be looking long-term in terms of that. In terms of additional funding, that hasn't come to my desk as yet, but you probably know that during the height of the pandemic, we did give significant additional funding to the nursing homes. We wanted to make sure a lot of that went to the frontline workers, those nurses who every day showed up and did what they had to do to take care of the patients they loved. So we did make a big adjustment there.
I mean, is there some concern that, you have these big for-profit companies, that run a lot of these facilities, suddenly crying poverty now?
Yeah, I mean, look, my door is pretty busy. The hospitals, the nursing homes, the not-for-profits, landlords. I mean, everybody is looking for a little help during this crisis. Just because our COVID-related numbers are really good doesn't mean any of us are out of the economic woods. Connecticut, as you probably saw in the press, we're doing relatively better than most of our peers. That does not mean that we are doing well. So, look, I've got my COVID relief fund. I've been working with Melissa McCaw on that in terms of how we can make sure that that goes to places most in need where it can make the biggest difference. As you know, for us, schools and testing were the two biggest priorities.
All right, thanks, Governor.
I think it's also just worth pointing out as well, Matt, that as the governor said, at the height of the pandemic, back in March, April, May, June, we did provide significant additional financial support to the homes. But even today, we continue to pay through our CRF dollars for the mass testing program that we're executing in nursing homes and assisted living facilities. So where there's a need for health and safety measures, whether it's testing, PPE, we continue to step in financially and ensure, and in fact, organize the testing as well for them and deliver it to their doorstep. We know that's a huge expense. We know that is absolutely critical and has been incredibly effective in reducing the spread of COVID in those homes. So we continue to play an important financial supports for those homes, recognizing that in the longer term, as the governor said, what the future looks like for the industry may change.
All right, thank you, John. Moving on to News 8.
Hi, Governor. It's Jody Latina. I'm curious, are you interested in negotiating with the tribes on the online gaming issue?
Hey, Jody. Yeah, of course. We've been talking to the tribes on and off on this going back probably 5 years. And online gaming is following what everything else in our economy is moving online as well, and I think it's a part of our future. You know, as you know, we get tripped up on, do I have an exclusive right to do this, or can others at least be able to participate in the RFP process? And, but yeah, my door is open, and it's something we should address.
Are you close to making some sort of meeting with all entities to get something hammered out?
I'm not sure about that. We've got a, you know, new chairman of the lottery, and he's helping to take the lead in these discussions. Look, it's gone on for years and years. There seems to be a slight difference of opinion about how broad the exclusivity is for just the tribes, but I think it's something we ought to be able to negotiate.
Thank you.
All right, thank you, Jody. Moving on to NBC Connecticut. All right, thank you. Associated Press.
Thanks, Rob. Good morning, everyone. Commissioner, congratulations. I wanted to clarify, is Northern still being used to keep COVID-19 inmates segregated from the rest of the population?
Great question. So early on, as I indicated, I'm moving away from Northern. Northern, as you know, has been a restrictive status facility, and based on the data that we found, offenders that were symptomatic at the time were hiding the systems in order to avoid going to Northern. So I've made a decision that we're going away from Northern. We've identified the facility that that we're going to be housing them, so then I don't have that fear in the inmate population that if we get to a point where we're the symptomatic offenders peak, that these individuals are coming forward, not having the fear that they're going to go to Northern and go into a different facility.
Will this alternate facility, can you name that one, and is it a lower level facility?
It's a level 4 facility. I won't name it because I still haven't informed the warden, so I want to have the ability to inform the warden and their staff before I make it publicly, but it's going to happen soon.
Okay. Thank you. And Governor, with no additional relief from Congress, some states are looking at everything from legalizing marijuana to raising taxes to handle budget deficits. Considering that, you know, we're facing about a $2.1 billion deficit in FY 2021, you know, are you looking at anything like that to try to bridge that gap?
No. Not right now. I mean, thankfully, we've kept in place our rainy day fund. That means we don't have to pull the trigger like a lot of our other states have on some of these issues. And I'm still hopeful that Congress is going to step up and do the right thing.
Thank you very much.
Thank you, Sue. Moving on to Hartford Current. All right, thank you. Connecticut Public Media. All right. WTIC 1080 News. CT and Vivo. Bocito Media. The Day of New London. And that concludes our press conference.
Let me just say one thing. I'm going to miss Dennis House on the evening news. He's a good man, and I think he earned the trust of viewers across this state in a time where there's a lot of divisiveness. So, Dennis, you're just getting started, my friend. Take care, everybody.